Hi, you're listening to the Hippie Martha Hormone Hour. I'm Ashley, your host and creator of the Hippie Martha, a business that supports women's health and everything else that comes along with it. In each episode, I'll provide you with bite-sized information that will give you a better understanding of your body and hormones in ways you probably wish you would have learned sooner. We'll dive into natural remedies, holistic health, and evidence-based care. I'm here to empower you to take charge of your health with knowledge. So let's get started. Hey friends, and welcome back to the Hippie Martha Hormone Hour. I'm Ashley, your host, and today's episode is going to be packed full of information. We're talking all about endometriosis, what it is, how it shows up, and natural ways to support the body, including some amazing herbal allies. I'm joined by my Instagram friend, fellow RN and FEMM fertility awareness educator, Morganne Skinner. Morganne has walked the journey with Endo herself, actually taking her 15 years to get diagnosed, and she's here to share her wisdom, both as a nurse and as a woman living with this disease. So, Morganne, welcome. It is so nice to finally chat face to face. How are you?
Yeah, I'm doing great. Yeah, I'm happy to be here and happy to chat.
Yes. So I think I usually like to do with my introductions, we always just start with a check-in. And I know we had mentioned that we're both in our kind of near ovulation. So
Mm.
always a perfect time to be vocal and speaking and be with one another. But do you want to check in with anything about your cycle right now?
Yeah, so I'm on cycle day 12, and for me, that is the beginning of my ovulatory phase. Some people might still classify that as follicular, but in FEMM, we put that in the ovulatory phase. So that's where I'm at. My mood is high. Actually, when we were talking about dates, I was like, ooh, this date would be great because I knew I'd be around ovulation then, which is great for articulating thoughts and speaking more clearly. So I was like, that would be perfect. Yeah, so I'm feeling more upbeat. I'm currently working through healing some gastritis, and I'm having a flare in symptoms right now. And I've noticed that I flare around this time of my cycle. But other than that, I'm feeling pretty good. My energy levels are quite nice.
Yes.
How are you?
I'm good. So I am on cycle. I had just had a look. I'm on cycle day 18.
Mm.
And I think I'm feeling middle schmerz. My temps were starting to kind of elevate a couple days ago, and I'm like, oh, yep, definitely ovulation is coming. And then my temps went back down really low. And so it was
Mm.
like my body really wanted to try really hard to ovulate, and it didn't. But today I woke up with just some middle pain and definitely feeling a little bit slower, so hopefully ovulation is coming. I have PCOS. I am also midlife, and so I think all of those things have kind of made my ovulation start to get later and later.
Mm.
So it's been interesting. Interesting ride, but I love being able to chart and understand my cycles more in that way. So
Yeah.
yeah, thanks for asking. So, okay, let's get started. I really want to start with your story because I definitely resonated with it. And I know there are so many others of us out there who can connect with it. So, what was your journey like with endometriosis, and what finally led you to diagnose after all of those years?
Yeah, so I had a really long journey to get diagnosed. It took from the time I started having symptoms until I had my final diagnosis was 15 years. And for me, the last 2 years leading up to that diagnosis were kind of like the worst years symptom wise and mentally, everything. It was just a really tough time of my life. And that was when I had a lot of other symptoms show up that most people don't directly think are endometriosis related, but turns out that they definitely are. And that is kind of what led me into getting diagnosed with endometriosis, actually, because for me, I always had painful periods, but it was really common in my family. And so I kind of grew up thinking that period pain is normal and we just had bad genes. Like I didn't think there was anything you could do about it. And so I would miss school a lot. I would miss sports practices, would have very heavy periods and pain medication didn't touch it. I always just thought like, oh, ibuprofen and Tylenol just don't work. Like they're just not good drugs because it never made a difference for me. So that was kind of like my lived experience with my periods, where that I would just have really severely painful periods and it would feel like I was getting stabbed in the gut. Like sometimes I couldn't even like stand up to walk to the bathroom from my bedroom. It was so severe. And I just thought that was normal. And then that happens enough, and everybody around me thinks like their period pain was severe as well. And so I kind of thought like, oh, I must be weak or I must not be able to handle what everybody else does. Point is, I never thought like, oh, this is like a red flag. It wasn't until I started having really debilitating digestive issues that I started to look into what's going on with my health. So, yeah, so the 2 years before I got diagnosed was when the digestive issues showed up. And so I started to have bloating, which a lot of people, when they're looking at endometriosis, they might hear the word endobelly. But for me, it was like distension that made me look 6 months pregnant. And it wouldn't matter what I would eat. I could even wake up that swollen. And it was very like a firm belly too. And it was very painful. So it wasn't just like, oh, I feel puffy today. It was like a very distended belly. And then I started to have food sensitivities, and no matter what I would eat, I would react to things. Digestion started to hurt. It would feel like I was digesting glass. It was just very sharp, very painful. Started to have diarrhea. Actually, for me, that was one of the biggest things is like diarrhea started one day and it didn't go away for a couple of years,
Oh my
no matter
gosh.
what I did. And that was related to the endo. So all this was going on, and it's actually very common with endometriosis to have GI symptoms. It's actually the number one thing that leads people to their doctors, even before the period pain, is to investigate that. And it ends up being caused by endometriosis. But, back at that time, I didn't know that was what was going on. So we ruled out everything you could possibly think. I had ultrasound, CT scans, I did all the scopes, I did stool testing, I did lab testing, I did SIBO breath testing, I did food sensitivity, intolerances, allergies, all of the testings you can think of, and everything was fine. My ultrasounds are fine, everything was fine. Along this journey, I developed mid-cycle spotting. Never had it before in my life. I always had some stomach pain, but I started charting my cycle just in a period tracking app. Didn't learn a method or anything, but just started tracking in an app just to kind of get some sense of what's going on. And that was when I noticed my stomach pain is happening mid-cycle. I was like, okay, so that's good to know. And then I started noting, oh, I'm spotting at this time. And then one day of spotting turned into week-long spotting and severe pain. And sometimes there would be clots along with the spotting during ovulation. So that for me was like, okay, this is like
Yeah.
definitely, absolutely not normal. It was like,
Right.
that was the one thing for me that I could say with 100% certainty, no matter who tells me it's normal, I know that it's not normal. And that was one of the things. Once I identified that I was getting these flares that were changing with my cycle, then I knew, okay, this is not IBS. This is not just a GI thing, because it wouldn't be this tied to my cycle. And that's what actually led me into researching about endometriosis. And then I found a excision specialist and I self-referred. And the interesting part is from the moment I met with the excision specialist until I got diagnosed, it was only 2 months, which is
Wow.
wild
Wow.
because, and like as
Yeah.
both nurses, like for me in my mind, it's like, can you imagine if we referred people how much quickly they would get diagnosed with endometriosis if they just saw the right practitioner? So that to me was kind of wild. But yeah, I know I just said a whole lot of things, but that was the summary of my endo journey.
That's amazing. I mean, I am sure people listening right now are just like nodding their heads and like woo woo for you because it's it's so hard. Like you said, it's so hard to figure it out, especially if you aren't trained in it, you don't know about it, you've never heard about it. So, a quick question, is this what pulled you into becoming a FEMM educator? How did you choose that type of fertility awareness method?
Yeah, so it was actually that exact experience where I was like, oh, wow, this is actually really helpful. Like, because at that time I was already a nurse, right? And so I trained in assessment and all of that. And I was like, this is actually really helpful. And so I wanted to share that as a tool with other women. And so when I was searching for different fertility awareness methods, I was really drawn to FEMM because it's focused on fertility education. And a lot of fertility awareness methods are really just about if you want to get pregnant or if you want to avoid pregnancy. But FEMM it had this whole other aspect of hormonal education and using your cycle chart to really just reflect your own health. And I was like, that's exactly like awesome. Like that was my experience and I wanted to learn more about it. The other thing is that FEMM, so it stands for fertility education and medical management. And so that medical management part means that when women chart their cycle with FEMM, they can see a doctor who's also trained in FEMM. And so they use the cycle chart as like a diagnostic tool as well. So yeah, and there's only two other methods that exist that do that as well. One is not even in the US. So there's only two in the US that do that. And so yeah, that's what drew me to FEMM and what made me want to teach that method.
Very cool. I know we both have said that we wish there was like the same thing across the board for fertility awareness methods and like the same language and lingo. And so yeah, it's cool. I love learning from you, and in my training as well, we learned about FEMM, and like we learned about all the different, methods and things
Mhm.
like that. And so it's really cool to see how there is something out there for everyone and you really can get the help that you need. So, yeah, I love it that you chose it. So okay, so going back, you mentioned earlier how long it took you to get diagnosed, and I think that's something so many women face. Let's zoom out for a second. What exactly is endometriosis and why is it so often dismissed or missed in the medical world?
So endometriosis, it is a chronic inflammatory disease where tissue that is similar to the uterine lining is found outside of the uterus. And so there's actually a lot of miss misunderstandings around endometriosis and a lot of outdated information. So I guarantee you, if you Google this definition, you're going to get a different definition. A lot of things are changing and they're updating, but you're probably going to hear that it's the uterine lining outside of the uterus. That is outdated. And that kind of ties into why it takes so long to be diagnosed with endometriosis is just because there's such a lack of research and a lot of outdated information and misconceptions. But going back to the actual definition, so it's the uterine-like tissue found outside of the uterus. It also is associated with immune dysfunction. So there's chronic inflammation, immune dysfunction, and there's these abnormal cells in the body, and it causes a wide range of symptoms. Some of it is related to where the lesions or the abnormal cells themselves are located. Some of it is more related to the systemic effect of the inflammation. So, for example, if somebody's having cyclical chest pain, that could be related to the actual location of an endometriosis lesion. But if somebody's having brain fog, that could be related to a systemic effect of the endometriosis. But
Yeah.
there's a wide range. So it affects digestive system, urinary system, reproductive system, immune system. So it's a very body-wide disease, even though most people, when they hear about it, they think it causes painful periods, and it can, but it can also cause a wide range of other symptoms as well.
Yeah, I think I've heard that it can be found in like earlobes, like in the
Oh,
tissues and
yeah.
earlobes. Crazy places that this tissue can be found.
It's been found in males, even. It's
Mhm.
been found in the brain, pretty much every part of the body it's
Yeah.
been found in.
I know there's barely any research, and I think now that it's becoming more and more, it's being great. Like way back when, if you had endometriosis, they would remove your uterus and then they'd
Right,
claim that you'd be fine, right? So
right.
nowadays, obviously, they're finding it in other places. How do they think it gets there?
They still don't agree. Like there's researchers have different theories. So kind of the two main theories right now, and I'll tell you which one I'm kind of lean towards, but the two main theories are retrograde menstruation, which is during the period, the the menstrual fluid, instead of flowing outwards, it flows backwards into the fallopian tubes, and that's how the cells get in the wrong place. But that doesn't seem to be correct because we know that it's not actually uterine tissue, but also I might have this slightly off, but I think it's around 70% of women experience retrograde menstruation, but it's a significant number. It's more than half. And only 10% of women on average, give or take, have endometriosis. So those two don't really line up. So that's one theory. The other theory is that there's like some type of mutation in cells during utero, and that's how they end up in different parts of the body. And so it's like, oh, the cell might have been meant to be uterine tissue, but as it developed, it didn't actually turn into uterine tissue. It turns into this abnormal tissue, but now it's in different parts of the body. That one seems to be a little bit more likely to me, just because that explains how these lesions are found in all these various parts of the body and also in men who don't menstruate and don't have a uterus. So like we can't really say that that's caused by retrograde menstruation because they don't go through menstruation. But yeah, that's another one of the big problems with endometriosis is because researchers and doctors and pretty much everybody, we don't agree on the definition. We don't have enough research is what it comes down to. So if you don't know how to define the disease and you don't know what causes it, that also makes treatment pretty difficult as well.
Oh, yeah, absolutely. I mean, there's such a variety of things, but I totally agree with you that that makes a lot of sense. And then it also makes sense that this pain almost like turns on when you start menstruating, right? I don't know if this is a myth or not, but is it due to estrogen turning on during your follicular phase or during ovulation? Is that associated with endometriosis, or does that like stimulate it to be more uncomfortable or stimulate it to flare?
Yeah, it's definitely connected to estrogen. And so once women, go through puberty and they're making more estrogen through the process of the hormones that are produced during the menstrual cycle, and they're starting to make more estrogen cyclically, that's correlated with pelvic pain and increased symptoms that are associated with endometriosis. But the endometriosis lesions themselves create their own estrogen supply. And so a lot of women can, especially when it starts to progress, you can experience pain and endo symptoms every day, all month long. It's not only limited to the period or ovulation, but for some it can be. And that is because of the rise in estrogen or the imbalance between progesterone and estrogen. And estrogen itself is inflammatory, and that can cause more pain as well. Then we have the endolesions making their own estrogen and their own inflammatory substances, so that can cause pain as well. But absolutely, there's definitely a connection and correlation with flares of symptoms and where somebody is in their cycle and what their estrogen levels are like.
Yeah. And this kind of like leads us into, I wanted to just briefly touch on talking about histamines and
Mm.
how histamines really have been known to be connected to those who have endometriosis, as well as, like I saw a graph the other day. It was like POTS, connective tissue disorders, and endo. And it's like this whole little conglomerate. So I don't know if you feel comfortable talking about that or want to touch on that just a little bit.
Yeah, it's really common in my experience. So when I'm teaching cycle charting classes, I work with a lot of women with endometriosis as well. And a lot of them also have histamine issues. And so there's a connection between estrogen and histamine. When estrogen increases, histamine is also increasing as well. And so if you're having a histamine intolerance, you can have flares around that. But because endometriosis creates its own estrogen through the lesions, you can see just by that nature itself that there's going to be more estrogen around, which can lead to somebody having more problems with histamine. There's also something called MCAS with the mast cells that a lot of women with endometriosis deal with as well as like a comorbidity. And that is also related to histamine issues.
Yeah, I know I feel like I could talk about histamines all day long. As a person who has really dove deep and fixed my own histamine issues, it's an ongoing process. Like you never fully heal, right? Like you have to continue with the maintenance. And I think
Oh, for
that's
sure.
a
And
huge
it's
thing.
because it's not like a yes or no type thing with histamine. It's almost like looking at like your bucket and how much histamine you can handle. I think it's so hard when you're working with histamine problems because it's like one day you can eat these foods that are technically high in histamines, and the next day you can't because there's lots of different ways we get histamines through food and things like that as well.
Yeah, definitely. So once someone finally gets diagnosed, which can feel both like relief but overwhelm, what are some of the first steps that you recommend they take in order to kind of get on that maintenance or healing journey?
Yeah, so I'd say the first thing I would actually ask somebody is when they say they're diagnosed is I want to know how they were diagnosed. Did they have a laparoscopic surgery with tissue that was removed and biopsied and it was confirmed that it was endometriosis, or were they told they have endometriosis without any biopsy being done? And that's very different. So it's very common for doctors to do a physical exam, review somebody's their chart, their presentation, and say like, okay, you have endometriosis. But the gold standard for diagnosis, like the only true way to diagnose, is with a biopsy confirmation, which is similar to cancer diagnosis because again, they're looking to see that it's that cell, right? So they need to actually visualize it. So that's my first thing. And that's not to dismiss anybody and say, no, you don't have endometriosis, but it's almost the opposite. So many people get ultrasounds and they say, well, my doctor told me I didn't have endometriosis. Well, you can't confirm or deny endometriosis through an ultrasound. I know there's more updated tests coming out and everything, but still the gold standard remains that the biopsy for confirmation. So if it's confirmed diagnosis that you have endometriosis, my next question is, well, did you have surgery by a endometriosis surgeon? Because you can see a normal OBGYN who does laparoscopic surgery and they can do a tissue biopsy and confirm endometriosis that way, but they don't have the same skill as an excision surgeon. And so the ideal situation is that you go in with an excision surgeon to get diagnosed. And at that time of surgery, they're also removing all of the abnormal tissue because that can minimize the time somebody is having surgery done. And excision surgery is the gold standard treatment. So that would be ideal. And if somebody says that they've seen just a typical OBGYN first, then I would recommend that they meet with a excision surgeon. It's very common for women to have more pain, worsened pain, and more symptoms if they've seen a typical OBGYN who does what's called ablation instead of excision. And it just has worsened outcomes. So, yeah, definitely would recommend seeing an excision specialist first. And then after that, for treatment, um, the best outcomes with endometriosis are seen with a multimodal approach, which basically means like working with a whole team and coming at it from all these different angles. So we're looking at diet, mental health, physical, pelvic floor physical therapy, exercise, lifestyle. For some people, it might also include seeing a GI specialist or a dietitian or a nutritionist. It kind of depends what the symptoms are. But in the vast majority of cases, surgery won't be enough. And not to go too far into this, but just to kind of like give an example, if you have lesions that were, let's say, on the uterosacral ligament in your pelvic area, you had that lesion removed, but it was also on nerves and also embedded by muscles and stuff. It's not going to automatically heal the nervous system tissue or the muscles there. Like there's still going to be pelvic floor dysfunction. There's still going to be lingering pain and other imbalances that need to be treated as well after the surgery and after it was removed. So just thinking about it through that lens, it kind of makes sense, right? That
Yeah.
like, okay, after surgery, I'm still going to need to see other people. So that's kind of like an example, but it really depends on each person and what their exact symptoms are. But in general, it does take working with multiple different people,
And I think when you say
different
that,
things to be treated.
right, exactly, like what comes up, I mean, as a brand new nurse, I worked in orthopedic floor, and these people would come in for total hips, total joints. Well, they're not just going to go home and sit on their butt and not walk again, right? Or do minimal movement. They're going to get physical therapy. They're going to go for checkups. They're going to do all those things. And so I think you have to apply the same thought process to this surgery and know that, yeah, it's going to take some time to heal. It's not just going to completely disappear. And yeah, you need to see other people to be supportive in your care and in your healing journey.
Yeah,
Yeah.
for sure. And
Yeah.
especially with something like endometriosis that causes chronic inflammation, that inflammation really wreaks havoc on the body. And that doesn't just get completely undone by having a surgery. Like the surgery itself is a trauma on the body and takes a lot to recover from. But in that constant inflammation, you really need to do a lot of work on the nervous system. Also, with the pelvic floor, I find needs a lot of work as well, and the digestive system too, because it has the enteric nervous system and the vagus nerve affects it as well. And so there's a lot of other work that needs to be done to kind of help the body regain balance even after the surgery. And for some people, there is a lot of ongoing treatment too. So it's not just like a time limited, okay, after surgery, I do this, but tends to be something, certain things you need to do kind of ongoing to get that maintenance. Similar to like somebody has diabetes, we're going to teach them about diet to maintain it. And it's not just a one-time thing. And then once they're better, they can eat however they want. No, it's like for life. You have to
Yeah,
do this. And it's
absolutely.
unfortunately that is the nature of chronic conditions, is it requires ongoing changes. But the good part is that there are things that are effective.
Yeah, absolutely. Oh, yeah. I mean, well, and that kind of leads us into this next part, which is herbs and natural support. And I know one of my favorite things about following you is your work with herbs for endometriosis. I took your class. Do you still offer that Herbal Allies class for endo?
I offer it throughout the year. I have
Okay,
herbal consults that are open
perfect.
anytime. But yeah, I do the live classes throughout the year.
Yeah, and I forgot to mention that you also are an herbalist. So
Yeah.
that is such a great added benefit of working with you, especially for endo, is you have all of that knowledge as well. So could you share a few of your favorite herbs or what herbs you use on a daily basis to support your body, or and just kind of share what makes them supportive for the endo?
Sure. Yeah, there's a lot I can say. I would turn to herbalism because of everything with endometriosis. And I think I want to address the elephant in the room, which a lot of people think like herbs aren't effective and that it can come across as dismissive when somebody's recommending somebody to take herbs for such debilitating pain, right? Like endometriosis is one of the top 10 most painful conditions a person can treat. So I don't want anybody out there listening to think like she doesn't get it, like she's just recommending herbs, like this isn't going to touch it. But I'm talking about herbal medicine, and a lot of medications are derived from plants. And so when I'm talking about herbs for endometriosis, there's a therapeutic level of the herb that needs to be taken to get certain outcomes. But just wanted to say that it can be very effective. The reason that I was drawn to herbs with endometriosis is because I was having a lot of side effects with medications, and I didn't like that would have such severe period pain. I would take ibuprofen, it would make my stomach hurt. And it was just like you take a medication, it causes a side effect, you take another medication for that side effect, and it's like the cycle just never ends. I did not like that, especially for something that's like, I have to do this my whole life or seemingly my whole life, right? I don't know what the future
Right?
is like, but I know I have to do this for a long time. So that led me to herbs because I thought there must be a better way. Like there must be other ways I can relieve this pain and not cause problems in other parts of my body. So that's why I went back to school and studied herbalism. And one of my favorite herbs for endometriosis is ginger. It's probably no surprise to you because I talk about it all the time. But this is a great example because ginger itself has been studied and compared to ibuprofen, and there's been multiple studies, and it's been found to be just as effective at relieving period pain. One of the reasons it works so well is both ibuprofen and ginger, they reduce prostaglandins, which are these inflammatory substances that increase leading up to the period, and it's responsible for a lot of pain. And it's not the only cause, but it can cause period pain. So if you can reduce that, you can reduce period pain. If you ever gone to the doctor and they would tell you take 800 milligrams of ibuprofen leading up to your period, that's why, is it decreases prostaglandins. Ginger does the same thing, but ginger, it doesn't have the nasty GI side effects. Whereas ibuprofen, if you take it, even just taking it for 5 days in a row can cause gastritis. Whereas with ginger, it actually relieves nausea, it relieves bloating, it increases gut motility, which is a factor that protects against SIBO. It has really awesome benefits for the digestive system. So it's kind of like a no-brainer
Yeah,
for endometriosis, and it's very effective at relieving period pain. I take it as a capsule, and I take it before my period and during my period, and I no longer need to take any other medication because the ginger works really well.
that's
That's one of my
amazing.
go-tos, and it's fairly safe for most people. So it's
Oh
one
yeah.
that most people can take. Time
Very,
it might.
it's really cost effective too. Sorry to interrupt you.
No, it's okay. It's I think it's tasty. I like it, and you can incorporate it. So the other thing you asked about like daily habits, I also drink ginger as a tea every day. So I do a quart of it and I just sip on it throughout the day like I would water, but instead it's ginger tea. And one of my like lingering ongoing like endo symptoms is I struggle with a low appetite. And ginger, it has a warming quality to it. And so it's almost mimics like that sensation of like burning you get when you're hungry. Ginger actually does that and it kind of tricks me into thinking that I'm hungry, so I eat more. But it also like from like the biological lens or whatever, it increases blood supply to the stomach. So it actually like kind of it literally does
Yeah.
waken up your digestive function. It speeds up gut motility, so it relieves bloating. So if you struggle with bloating day to day, like it helps with that as well. And it helps a lot with that. And so that's something that I take just every day, just as like a maintenance for reducing day to day pain, for relieving bloating, and for supporting my digestion. Now, depending on what symptoms you're having with endometriosis, there's going to be other herbs that you might want to turn to. If we're just talking about period pain, my next favorite is cramp bark. And I take that as a tincture. And it is really effective at relieving muscle pain. Fun little story. I had a friend visit a couple years ago and we were on a hike and they fell and they kind of like they landed on their shoulder and like their neck on like a fallen tree. And I was like, oh well, I have cramp bark. I can give you some if you want to like relieve it. It relieved his pain like pretty much instantly. Yeah, and it's really effective. And the uterus is also made of a ton of muscular tissue. So something that relieves muscle pain can also relieve period pain. So that one is something that works like in the moment, whereas ginger as capsules is more of a preventative for period pain. And so I usually will work with them both. If I need like extra pain relief during my period, then I'll take the cramp bark. But yeah, I haven't really needed the cramp bark in a long time because the ginger has really done its job.
I also take ginger for my migraines. I have found it very effective. You kind of have to take it at a little bit of a higher dose initially. So like if I find that I feel a migraine coming on, I'll take like a really higher dose and then it really lessens like you said, it lessens the pain. It's like it reduces that inflammation. And I know
Right.
like in Chinese medicine, it's like a warming herb. And so not only for your womb, you want your womb to be warm around your period and for that blood to flow good. And so if your womb is cold, in Chinese medicine, they say a cold womb has a lot of stagnation, a lot of clots, things like that. So yeah, ginger. Amen to ginger. I have yet to try cramp bark, but I kind of want that in like my little apothecary now because yeah, I've heard you talk about it a couple times.
Yeah, it's so effective. I recommend having it on hand. It doesn't taste good, just to be warned. It's
Many,
good.
many herbs do not taste good.
Yeah.
Let's jump into some listener questions from Instagram. So I had posted a little conversation box, and a lot of people they came up with some really good questions. And I was like, this is perfect. So the first one is, what do I do if I don't want surgery, but I have all the signs leading up to endo, like all the classifications? What do I do?
Yeah, that's a really good question. It the specifics really depend on what symptoms this person's having and what their goals are uh, for the management. So that kind of limits where I can go with this and what I can say. But just in general, a few things that can help most people with endometriosis, not knowing what the symptoms are. I would say see an acupuncturist. Acupuncture, I love traditional Chinese medicine. Like if I ever go back to school to study something else, I think it would
Same.
100% be Chinese medicine. I just love acupuncture so much. I go every week and it's something that has just become part of my endo management routine. And I will die a very happy person going every week. Like I just love it so much. And it's so helpful. And one of the reasons I really love it and something that was really comforting to me even years ago when I first started going is that the acupuncturist can treat you without having to do any type of other diagnostics. You just tell them your symptoms and they can treat you. And not only like your endo symptoms, but mental health, your emotional state. They treat you as a whole person in your whole body. And it works so well. No matter what I go in with, it's like, it is so amazing how much it works. So, like, from the physiological perspective, how it works. So I'll talk about it through Chinese medicine and also Western medicine for people to kind of like make sense of it. But from Chinese medicine, it's working by moving qi throughout the body and it can balance the body systems essentially. So there's 12 different meridians in Chinese medicine, and there's different points throughout the body that correlate with the sense. And putting in the needles is helping to balance that qi. So if the qi is stuck, it can help release it, but it can also help increase the qi. And so that's kind of how it's working. And in Chinese medicine, qi is like the life source. And it's really important if we think about it to like blood flow. We want our blood flowing in the right direction into the right areas. We don't want it just stuck in one area. We want it moving around. And in Western medicine, acupuncture, it helps to support and modulate the immune system. So basically, it helps the immune system do its job, which with endometriosis is also important because there's been studied and found immune dysfunction. It helps relieve pain. So some studies show that acupuncture helps the bodies with its own endorphins. And so it helps with that. And it helps increase circulation. And so that's kind of almost exactly what Chinese medicine says it does too, but it helps relieve circulation. And so there's a lot of times period pain is related to stagnation in the pelvic area, and heat and blood flow to the area helps to improve that circulation. So it helps in that way. And so it just helps in so many areas, and it can help with increasing fertility as well. A lot of people with endometriosis are also concerned about their fertility because endo can impact fertility in many ways, and acupuncture can help with that too. So that's kind of like my umbrella basket recommendation. No
I
matter
love it.
no matter what symptom you have, acupuncture can
Acupuncture.
help. And the other one I would suggest is seeing a mental health therapist because our emotional state really impacts our lens through how we feel and think about things. It impacts the nervous system, but it also isn't going to impact our stress, which has a direct impact on hormonal levels inside of us. And that's going to impact how we actually feel with endo as well. It's all related, but there is just a significant amount of stress and complex feelings that come with being diagnosed with a chronic illness, especially when the fertility is involved. There can be a lot of grief that comes with that. And so being able to work through that with a mental therapist is really important as well.
Absolutely. Yeah, I will say too, I recently started working with a somatic therapist.
Mm.
And what the somatic therapy is it's just identifying where you're feeling things within your body and what comes up, and then going back to why that feeling might be there. And so that
Mm.
has been really helpful for me, especially on my healing journey. I kind of put it off. It was like the last thing I wanted to do because, of course, feelings are uncomfortable for me. So they're not for everyone, but for me, they are. And so that was like the last part I feel like that I've seen in my own healing journey is doing that therapy. So that's a great recommendation. And of course, I just started working at an acupuncture place. And so I
Oh,
am in
awesome.
love with acupuncture, love it. That's how I even became present at this place because it has really helped me with my journey as well. And the pain, it's crazy how one needle, I remember this one moment where she put one needle on the top of my head. I was having gallbladder pain and it completely dissolved within moments of her putting that
Isn't it?
needle in.
I love acupuncture so
Yeah,
much.
it was great. I loved it. Okay, so another listener asked, are there any good books or resources for women with endo who want to learn more?
I really want to say yes, and I want to provide a list of all these things, but there are some resources for sure. I will say that. I wish there was more. I wish I could like list out all of these different resources. There is a book that I really like. I don't know the actual titles. Yeah, maybe if we can provide something
Yeah,
in like show notes or something with
yeah,
the title, but there is a book. I can't remember the name of it.
that's okay.
Finding Peace with Endometriosis or something like that.
Yeah,
That's really good with kind of walks you through a person's lived experience with endometriosis so you can like relate to it but also find hope through it as well. And I'm become friends with Instagram friends with the author of it as well, and she's a big advocate for endometriosis. And
yeah,
a good resource is icarebetter.com. They have a directory tool for you to find an excision surgeon. They also now list other practitioners like pelvic floor physical therapy on there. So you can find somebody who specializes in endometriosis, and you can do it just through by looking in your location. And they have a blog too, and they do a really good job at filtering information and really like analyzing studies to make sure the information they're sharing is accurate and up to date. So that's a source that I trust as well.
yeah, absolutely. Yeah, you've shared that with me before. It's funny because the next question is, how do I find a doctor that truly specializes in endo? And I know
There you go.
in my state, there is just one doctor. So, in some states don't even have that one doctor. So I've seen a lot of people who have had to go out of state to get in. And so it's
Yeah.
really a travesty that like there aren't more. And maybe there
Yeah.
will be at some point.
One thing I want to share on
Yeah.
that is that some will do free case reviews where you'd have to go through the office and check, but that's one tip I like to give people if they don't have a office near them or like within like reasonable driving distance, to see if they'll do a free case review or see if they'll offer your first appointment to be a virtual telehealth appointment. Then you can see a lot of them will just do like kind of like a triage appointment where and they can
Yeah.
see through your symptoms and things if they think that you have endometriosis before you make the travel, because that is the one of the unfortunate realities of living with endometriosis is that there's just not enough specialists to treat all of the people with endometriosis. So unfortunately, a lot of people do have to travel to see them, but I will say that it's definitely going to save you time, money, and effort in the long run if you see an excision specialist. I've worked with far too many people who don't do that first, and then they end up with a lot more pain, symptoms, a longer journey. So, yeah,
Yeah.
it definitely is worth that investment up front.
Absolutely. Yeah, I agree 100%. I have yet to do that, but this is a great question for me too. So this
Okay.
next question is, will endo get better after menopause, or is that a myth?
That's like a yes or no answer. So it's a myth in that it's not when you hear that, oh, you can't have endometriosis because you're in menopause. That is a myth. That is not true. And the lesions don't just disappear. And I can't say that it's always going to get better or that it's never going to get better. There's a lot of nuance there. So I'll answer this with a few short examples. So, one way symptoms could improve after menopause is that if you're no longer having those cyclical increases in estrogen caused throughout the menstrual cycle, then symptoms could appear better or actually be better if you're not having that increase of estrogen that is stimulating those flares. So that could be a way it could feel better to that person. However, if you have endometriosis that has infiltrated the gut and caused constipation. So an infiltration is like, think of it like a tumor in your gut, like the lesion has actually grown into the bowel. And if it's physically blocking your stool from exiting, causing constipation that way, It's not going to get better just because you've stopped having a menstrual cycle. That will stay there until it's physically removed through surgery. Those are kind of like two just quick examples to show that it may or may
Right.
not get
Yeah.
better. But same thing goes with like if you have your uterus removed. I think that one is unfortunately, like you mentioned
Mm-hmm.
earlier, it's one of the most common. It's either that or birth control is what
Mm-hmm.
most of the time doctors are going to recommend. But
Yeah.
if we think back to the definition of endometriosis, and it's not uterine tissue, it's actually tissue found outside the uterus. So if you remove the uterus, you're still going to have symptoms
Yeah.
and the lesions are still there.
It's not fun. It isn't. It is, like you said, it is a chronic disease, and you have to learn how to live with it and how your body responds to things and what you can do in order to decrease that inflammation. So this last question is, I think you actually touched on it, which was really good, but is spotting after intercourse or throughout my cycle a sign of endometriosis?
Yes, it can be. And that was one symptom I didn't mention earlier, but I also had spotting and pain, spotting after intercourse and a lot of pain with intercourse. And yeah, that is abnormal. It should not be happening and it is a sign of endometriosis. And one of the reasons why, when tissues are inflamed, they bleed. And with endometriosis, another sign, we didn't talk about this a whole lot, but another sign you can see is heavy periods or abnormal bleeding, bleeding in between periods. Those are signs of endometriosis. And when I say the inflammation, it leads back to that chronic systemic inflammation because, again, it's not only related to the reproductive system, but it's very connected for
Yeah.
sure. So, yeah, if you're having spotting throughout the cycle and if you're having spotting after intercourse, I would definitely talk to your doctor about the possibility of you having endometriosis. It could be something else. Could be like polyps, for example, is another cause that could cause those types of spotting or fibroids potentially,
Mhm.
but it could be endometriosis. But whether it's one thing or the other, it's not normal. So definitely warrants an evaluation.
Absolutely. Yeah. And I think too, going back on that, what are some things that you look for on other people's charts? I don't know if we covered that, but if someone were to start charting their cycles using a fertility awareness-based method, what are some things that I know what I look for, but what are some things that you really have the eyesight for when looking for endo in someone or questioning it?
So yeah, so when I'm looking at somebody's cycle chart, I'm looking to see if it's within normal parameters. So just like we will just like we monitor other vital signs, we use ranges to see if it's normal or abnormal. And so with them, we have set ranges of like how long the period should be, how heavy it should be, how many days of cervical mucus, how long the luteal phase should be, how long the cycle should be, things like that. So when I'm looking at a brand new cycle chart, I'm looking, is this within normal parameters or not? When I meet with a client for the first time, they give me like their health history. So I'm already going into this with like their symptoms, their history. So that already gives me some red flags and things that I would see in a cycle chart that are consistent with endometriosis. Usually, women tend to have shorter cycles or normal length cycles. So, like 28 days or less for their menstrual cycle, but they have heavy periods and tends to be either long periods or just heavy periods within that short cycle. And so that's very like specific with endometriosis. And then they tend to have spotting before the period and spotting after the period. And the spotting after the period tends to be brown spotting. And in FEMM, we call it tail end brown spotting. But if I see somebody who's set, let's say they have 4 days of bleeding followed by 3 days of brown spotting afterwards, and with, let's say, 2 or 3 days of spotting before the period, that's very characteristic of endometriosis. Could be other things, but when we put it together with the whole picture, that could be related to endometriosis. Spotting with ovulation, I see that a lot with endometriosis along with pain. And then a short luteal phase. So if their luteal phase is on the shorter end of then it could be in the normal parameter, but it's on the shorter end, all of that together. And then if they take temps, they tend to have lower temperatures. And one of the reasons for that is estrogen is cooling, has an overall cooling effect on the body. And so that's one of the reasons why.
Yeah. Yeah, that's so good. Yeah, I see that a lot too. And it's funny because I'm like, oh, you're describing my cycle like like to a T.
Yeah.
So, there's always
Homework.
that. Well, Morgan, this has been such a rich conversation. Thank you so much for sharing both your personal story and your professional knowledge. I know that it's going to help so many people listening today. And just before we wrap up, where can listeners connect with you and learn more about your work and maybe even take some of the classes that you provide?
So the best way to find me would be on Instagram. I'm at fertility defined. My website is the same. It's fertilitydefined.com. And I have links to my class registration and class sign up on my Instagram page as well. So that'd be the best way to find me.
Perfect. And I will post everything in the show notes. And we'll get those other references and things for you as well. So, to everyone listening, thank you so much for being here with us. If today's episode resonated with you, share it with a friend. Follow both Morgan and me on Instagram and keep learning about your own hormones and cycle health. Until next time, this is Ashley with the Hippie Martha Hormone Hour. We'll see you soon.